Hi, my name is Luz Leeds. I'm from I Don't Care About 60. I wrote my book and I mentioned the bioidentical hormones, which I have been using for many years and have been helping me a lot. And I would like, and also people have been asking me a lot of questions about the bioidentical hormones. And I had the perfect person here with me, which is Dr. Chuck. Chuck, could you please tell us a little bit about you? And I'm going to ask some questions to Chuck, and we're going to make it part 1 and part 2. So, hi Chuck.
Hi, I'm Dr. Chuck Robertson from Compounding Docs Pharmacy in Boca Raton, Florida. We've been helping women such as Luz for over 10 years now, and basically hormone replacement is the primary practice model for this pharmacy. So you can ask your questions.
Okay, so here is the first question. What are the hormones and how do they work?
Okay, you basically, men and women both have estrogen, testosterone, progesterone, DHEA, all in different quantities because, you know, women predominantly are more estrogen sensitive toward, whereas men are more testosterone and DHEA driven. As far as what these do with the body, there are a myriad of cells within the body, from the brain all the way to the toes, that are innervated or have some type of effect that have the receptors for either estrogen, progesterone, or testosterone in them. So there's, you know, to say what each one does, we'd be here for a long time.
For a long time. Okay, we don't want to be that. We want to have to answer all of these other questions to have more idea about. So my next question is, what is the key of the hormone replacement therapy?
The key is balance. It's always about balance. The body, homeostasis, metabolism, everything is about balance. It's making sure that the proportion of estrogen to testosterone or estrogen to progesterone is proper in order for the body to function correctly. If you have too much estrogen, then you start to gain weight and you start to feel bloated. And if you have too much testosterone, you start to lose your hair. You know, there's a lot of different things. So the key to hormone replacement is balance.
It's balance. Yeah, I agree 100%. How are the bioidentical hormones different from the synthetic hormones?
Okay, synthetic hormones are produced in a lab, even though bioidenticals are produced in a lab, but synthetics are not the exact same structure as the estrogens, the progesterone, testosterone, DHEA that our body produces. The synthetics, traditionally one of the main ones is Premarin. It's derived from horse urine. So therefore, it has probably about 20 different estrone-like substances. And estrone is not that great for your body. And the whole thing is that those synthetics interact at the estrogen receptors and the progesterone receptors, but they're not the exact same molecule. So therefore, those extra side chains that make them patentable for the manufacturers also lead to different side effects. Whereas the bioidenticals are derived from yam, wild Mexican yam, and soy plants. And basically then they're processed in a lab and synthesized to be the exact same molecules as the progesterone, the hormones that you make in your body naturally. And those hit the receptors, and the receptors see them as themselves. So therefore, it's basically like, it is hormone replacement, it's not hormone substitution. And you don't get as many of the side effects as far as the propensity towards cancer and that sort of thing. There's always that risk no matter what you take. It's just in the amount that you take. So that's why the good part about bioidenticals is that they can be measured in the blood or in the saliva. Whereas the synthetics, the doctors and the OBGYNs, they just give you pills and start you on them and just go by how you feel. And you can't get a blood level on them. So you don't know if you're too high or too low, except on how you feel. And you can actually be too high on estrogen and feel okay, but then that's leading a propensity towards cancer of the breast or the uterus.
Where is the hormones?
Well, as somewhat as previously stated, with less side effects, and the fact that they are so individualized, they can be individualized, customized to the person, depending upon their symptoms, depending upon their preference for route of administration. You know, some people prefer to take a capsule. Well, we really don't want patients to take estrogen or testosterone by mouth, because once they cross into the once they get into the liver, the metabolites aren't that great for the body. So we prefer to do testosterone and estradiol either sublingually or topically, topically being the main way to do it. So it's just, it's all different.
Are there side effects associated with the bioidentical hormones?
Of course there are. You know, side effects are inherent in anything. It's just that you have to make sure that you're starting at the lowest dose, and working your way up, as opposed to starting high. When you start high and things are not in balance, you can have weight gain, you can have fluid retention, you can have
high flashes too, huh?
Yeah, hot flashes, because if you don't have enough, or if you have too much, it's funny, but if you overdose a woman on estrogen, she can have hot flashes as well.
Yeah.
And everything is tied together, because estrogen, your sex hormones, and your thyroid are all intertwined. So you have to make sure that you look at every single part in order to start a regimen.
So you have to have the three hormones together, like the estrogen, the progesterone, and the testosterone together?
Well, it depends on what you need, because some people, they produce enough DHEA and testosterone, and they only need the estrogen and the progesterone. So it varies. That's why we do blood levels or we do saliva levels initially, in order to assess what each patient needs. Everybody's different, so but for a woman who has a uterus, if you're getting estrogen, you're getting progesterone. Okay. And as far as what standard ACOG gynecologists will say is that if a woman doesn't have a uterus, she doesn't need progesterone. Well, a woman's more than a uterus. And so there are a lot of other tissues in the body that have the receptors for the progesterone. So that's why we don't just rule that out immediately because a woman had a hysterectomy. If a woman's not sleeping, you're going to give them oral progesterone at bedtime because it helps them sleep. It hits the GABA receptors in the brain and calms it. If a person's anxious or whatever, it helps to calm them down and it helps to make them sleep.